Hello, everyone. It is September 5th, and I've just given an update. I had a pre-op appointment this morning just to do like an EKG and all my vitals, and they ran some labs and wanted to make sure I wasn't pregnant. So I'm pretty sure I'm going to pass that test. But I've got my pre-op meeting with Dr. Michelle LeBlanc this afternoon, so that's at 3. So I'm able to see about 4 people today, which is good. And I'm just trying to make sure I get as many folks in as I can before I'm out for about 6 weeks. So the timeline is definitely ticking down. So this time next week, I will have had surgery. So my surgery is September 11th. I have to arrive at 5 a.m. I've got to drink this like sugary solution at like 3 a.m. And then I can't have anything before surgery. And then surgery itself is going to be at 7:30. So wish me luck. It'll be pretty early in the morning for most of you, but I'm hoping that I'll be able to get home, sometime before noon, and then hopefully they've got me on pretty decent pain meds that I can tailor off when I'm able, and hopefully I don't feel too terrible, but we'll see. The MRI last week, I'm still waiting to get my CD in. They didn't have like ink for the printer for something, so they couldn't get me my MRI, but I will try to pick that up before surgery. And Dr. Rob gave me a call and just said everything looked really good on it. The thickening of the skin is even reduced, so everything's really reducing. The lymph node involvement is quite low, so it's really about circulation with gadolinium. So I'm not sure if that's the most specific test, but I'm hoping that gives LeBlanc, a little bit of push to maybe test the lymph nodes before she takes too many. I will obviously request that again today and probably before surgery, just to make sure that's all out on the table. I had treatment yesterday, so yesterday morning at 8:30, I had Herceptin, the full dose, first time full dose, and Perjeta full dose, which I've been doing. I still had to bring my cooling stuff for my hands and feet to avoid neuropathy, which is still a side effect of Perjeta. But I haven't yet suffered from any neuropathy, so that's great. I went by myself because my friend who normally can go with me had to work because it was a Wednesday, and I was able to swing by and visit her on the way home, which was nice. But I had to have some friends take care of Juno, and so we had a puppy sitter instead. I think she's just chilling on my floor. She's already totally worked into the office dog role, so I'm really enjoying having her in my life. I'm gonna let you see her again. I'm sure that's terrible for you guys to see from here. I'm holding the phone. I forgot my little thing, my little tripod at home, so we're just kind of throwing this out there, but I'm gonna have another video, I hope, before surgery. I just wanted to check in with you guys and let you know that everything went well for treatment this week. I'm going to every 21 days. And of course, they didn't have the Benadryl IV on the record, but my nurse was able to see that I'd had that every other time. And so she put the order in and hopefully pulled it forward for the future treatments. My decision will be how long I want to stay on Herceptin and Perjeta with the amount of toxicity that it does gift to the body. So I want to make sure my numbers stabilize, and I'll continue it through surgery and the recovery, and then maybe we'll start, looking at if it's still doing its job really well. I don't have anything really to teach about today, other than I did forget to mention chlorella was a really good gentle detoxer for gadolinium and heavy metals in general. So I've been doing some chlorella. I've got like the small little capsule tablet kind of things, so they're not so bad. It's like a blue-green algae that's really healthy, has a lot of minerals as well in it. So chlorella and then spirulina are really nice combos for people who need to help oxygenate their blood and get some good trace minerals in there. So I've added those back in a little bit. I will be cutting things out before surgery, and I'm on the fence about Toradol. I think a good compromise would be to take it after surgery. It's an intramuscular injection. It does have decent effects on the liver, which I'm not super pumped about. It doesn't thin the blood significantly. It was like 2% to 3.5, so it's not really anything that I'm really worried about thinning the blood, but I don't feel great about taking something and not letting them know, especially an NSAID, which I know can have a lot of issues, and it does have contraindications with other drugs. So I couldn't find anything specific with general anesthesia, but I'm not quite sure what I'm going to be on. So I think the way to do it will be just to take that the following days after to help hit the inflammation cycle from a few different angles. I'm not going to take it for pain. I'm really trying to take it to help reduce the metastases, the potential travel of cancer. So I think that's a decent compromise. I still have a lot of reading and research to do this weekend to just make my mind settle, even though I feel like I've probably come across all the answers I need. And yeah, it's kind of crazy. We're looking at surgery now. So I think it's a kind of a great, but also sort of bittersweet thing, because it's the next step of reality that now my body's going to be missing a few pieces, which feels kind of weird. But, you know, if it allows me to stick around a lot longer, then it's a minimal compromise to extend my life. So I am totally on board. I have no regrets about surgery. I may get some anxiety as it gets closer, but I don't know. I don't know how I'm going to feel. I think I'm a little nervous because I'm just afraid of anesthesia and, you know, hospitals in general, but I'm sure it'll go just fine. I feel really safe in Dr. LeBlanc's hands, and, you know, I think it'll be okay. So I just wanted to give you guys a little update. I hope you're all doing well, and I will do hopefully at least one more update before surgery. If you guys are able, I do still have the GoFundMe. Some people send some checks, which are nice. Then GoFundMe doesn't take a portion out. But if you have the ability to help financially, it would be most appreciated, because I am still having to maintain, you know, not only my mortgage with my partner, but my office. And I have worked, you know, basically less than a quarter of what I used to work this past year. So it's been financially a pretty tough year, of course, with more money going out than it is coming in. But I know that there's a lot of people out there struggling, so I don't want to put that on you in a burdensome way. I just would extend it if you're able, if you're in a financial spot in your life that you're coasting pretty good, and, you know, maybe you're looking at a lot of frivolous things to buy stuff with. You know, if you want to throw a little to a cancer patient, I'd love it. Otherwise, I totally understand, and I really appreciate all the help I've gotten so far. It has helped me afford mistletoe, which I will be on for a while after this, but hopefully it won't be as expensive as it has been. So I just want to say thank you for all the help everyone has given me already, and all the continued help. And yeah, I'll touch base with you guys pretty soon. Have a great week, and take care.